Welcome to the Paracetamol by Purvesh. In this video, we're gonna see about USMLE Step 3 exam, CCS Cases basic order list. These are the basic orders. With the help of these basic orders, you can diagnose, at least you can do the primary diagnosis of any particular disease which is coming in the exam. So here I took two situations which is mainly coming in the exam. One is ER, like emergency room visit, or office visit. So both has a different kind of basic order list. So we're gonna see those orders in detail, and then we're gonna differentiate diagnosis, and then specific test, and then confirmation diagnosis. All right, so if any patient coming to the ER, first thing we're gonna do is pulse oximetry and vitals. What else we gonna do? We're gonna attach cardiac monitor, we're gonna do EKG, we're gonna check serum glucose by glucometer, like faster version. All right, after this, if for example pulse oximetry is abnormal, we're gonna give oxygen therapy and we're gonna check atrial blood gas. If vitals are abnormal, what are we gonna do? We're gonna do IV line placement and normal saline. All right, if EKG or cardiac monitors are abnormal, we're gonna do echocardiography plus cardiac enzymes like TROP. All right, if serum glucose is elevated or increased or decreased, we're gonna treat according to that. If patient has a low serum glucose, we're gonna give glucose. If patient has a higher amount of glucose, like for example diabetic ketoacidosis, we will give normal saline and insulin. And we also gonna check serum electrolytes. All right, now what else we gonna do? CBC, metabolic, lipid. All right, metabolic panel, lipid panel, urine analysis. If patient is female, do not forget to do beta HCG. If patient is female and like within the reproductive age, do beta HCG. If patient sounds like infectious etiology, do blood culture, urine culture. Chest X-ray. Patients look like infectious etiology with respiratory system involvement, do sputum culture, sputum AFB, and sputum microscopy. And one more thing, sputum gram stain. Here, before with the blood culture, you can do one more thing, that is gram stain. All right, you also can do urine gram stain. It's up to you. After this step, you will at least come to the primary diagnosis, or you're gonna be like, okay, so this might be a disease. Now I have to do the confirmatory test. So once patient is stabilized, by the time patient will be stabilized, and what you can do, transfer to the inpatient. Or if patient is mechanical ventilated, then transfer to the ICU. Contact a significant department, like for example if patient is admitted with the toxicology stuff, then do serum toxicology screening and urine drug test. All right, and contact psych if patient is infectious etiology, then contact infectious disease. All right, if any case, like if patient is coming with the rupture of membrane or whatever, like gynecological issue, then contact OBGYN. So this should be the order. First, vitals. Second, laboratory test. You can add imaging, then more specific stuff, and then next appropriate treatment, and then consult. All right. Now, when patient is coming to the office, it's most of the time it is not the serious situation, and same in the CCS cases also. So we do pulse oximetry, we take vitals. Patient has a chest pain, then we can do EKG, we do CBC, metabolic panel, we do lipid panel, we do urine analysis, of course we do beta HCG if patient is like a reproductive age and not using contraception. This detail will be given in the case. All right. Okay, so if patient is having an infectious etiology, for example cough, do chest x-ray, sputum analysis like sputum gram stain, sputum culture, sputum AFB. If patient is compromised, for example if patient needed to be in the hospital at this time, transfer immediately to the inpatient department. It works like this. All right, I really hope you're gonna find this video very helpful. Again, first give it to the vital, second give it to the basic test, third give it to the imaging and special test. So that's how I divided the area. Okay, you can remember this. I took pulse oximetry, vitals and EKG in the vital area. This is a basic test and this is imaging plus specialized test. All right, thank you. Please do subscribe. I will upload more video in future. Thanks. My name is Purvesh. Take care. Best of luck.